funky.
Hello everyone and welcome back to Mom Stinks. In today's episode, I'll be highlighting each of the individual roles of your child's medical care team and how you can play a role in that team. I will say that I think it's extremely important to feel comfortable with your child's medical care team and to help foster a climate of mutual respect and, open communication. Relationships are important for any career, venture, anything really dealing with people when trying to accomplish a goal. And I don't see how dealings with your hospital staff would be really any different. Now, I'm not saying go out and buy them gifts or fraternize. I'm simply saying that smiling, greeting, being able to, hold a conversation is not only noticed by the person on the receiving end, but your child. Let's face it, during a time that's already difficult enough in their life, regulating the energy that surrounds your child is important. Your child's energy is heavily dependent on your energy. Because Ella's, such a pleasure to be around. I often hear nurses say that they fight to be on service with her, and that's because I think my husband and I do a really good job of, giving off good energy to her. As difficult as it may be for us on the inside, I think, she's really, truly a reflection of us. But, with her own little gifts as well. So I think that's important. And going back to relationships, the other day we were having scans. Ella has scans every 2 cycles. And I previously mentioned in another episode that she can't eat for 12 hours before those scans because she's always sedated. And I try to advocate for ensuring that she's scheduled in the morning. And I've been noticing just, by sheer virtue of being pleasant on the phone, asking questions, and, being friendly with the scheduler, like she goes out of her way to at least say she's going to try to bump Ella up, especially if it's a last minute scan. She went out of her way to come physically see me in person the other day and hand me her next cycle's scan, which she has her in the morning. So I really do think it helps. And anything that helps this journey and makes it easier for you all, as difficult as it is important. Let's talk a little bit about the hospital staff and what they do, because let's face it, there's a ton of people that you're going to meet or have already met, and it's easy to get them all confused. It seems like they all do similar things. So let's get right into it. On any given day, you may come across a number of different doctors who come into your room and all seem to say the same things and ask the same questions. Now, if you've watched enough Grey's Anatomy, you already know all of this information, so just bear with me. First, you have your attendings who they're the supervisory doctor that's completed training in a specific field of medicine. I like to consider them as the HDIC, which is the head doctor in charge. They'll come visit every day, sometimes with another fellow or resident to check on you while inpatient. Then you have your fellows. Those are the doctors who are done with their residency training and are now training in a specific specialty. You also have your residents, who's a doctor who's completed medical school and is training in the hospital setting. And of course, you have medical students, depending upon which type of children's hospital you're at. A lot of them are teaching hospitals, so they'll have different medical students and residents follow the fellows and attendings. But those are students who are studying to be a doctor. Then you have different specialty doctors like clinical psychologists who work with you to learn how to deal with the demands of an illness or treatment. Then you also have your anesthesiologists who supervise your child before, during, and after a procedure. You also have audiologists who are the hearing doctors, physician assistants, etc. Then you have your nurses. Your primary nurse will be a registered nurse or an RN who's responsible for the around-the-clock monitoring and hands-on care for your child. This nurse is responsible for planning and coordinating your child's care throughout their stay. Then you have your nurse practitioners. These are the advanced practice RNs who are trained in a specific area of healthcare. They're trained to assess, diagnose, and order tests and labs and formulate treatment plans for your child. While inpatient, these are the nurses I ask all the questions to about my daughter's treatment. Next, you have your charge nurses. These are the RNs that are in charge of making sure that the unit runs smoothly during a shift. They're the person on the floor who's available if you have any question about your child's care while inpatient. A good charge nurse advocates for families. Then you have your nurse manager. They're the RN who's responsible for the 24/7 operations of the unit. Normally, you do not see them. And finally, you have your care partners, also known as your patient care services aide. These are the aides who are responsible for assisting the nursing staff with the care of your child. So, getting you anything you need, whether it be water or diapers, taking vitals, really things to help the nurses focus on the medical care of your child. Other team members you may encounter while at a children's hospital include your nutritionists. These are the nutritional experts that evaluate your child's eating patterns, and they work hand in hand with the medical staff to ensure your child is getting exactly what they need to help the healing and prevent diet-related issues. You also have Child Life, which is one of my favorites. They're the trained specialists who are there to help kind of ease the stress and anxiety related to your child's medical experiences. They utilize a number of different resources, including technology, dog handling, games, etc., to be able to do this. And when Ella gets her dressings changed on her central line in her chest, or is about to undergo a sedated procedure, they come and play with her, attempt to distract her, kind of makes that procedure a little bit less nerve-wracking for her. They're also there to provide support and answers for siblings of your child who are experiencing this journey as well. Then you have your social worker. Now, I will just say not all social workers are created equally, but they are a trained specialist responsible for the emotional support of your family and your child. They're the link between you and any hospital or community resources of funding, any other family-related stressors like divorce, history of violence or abuse, parents who have minimal support systems, also your child's psychosocial needs pertaining to their treatment and its effects on their life. They're also your child's school or educational advocate. Really, any concern you have for your patient or your ability to care for your child becomes that social worker's issue. This person can also provide you with a number of different resources that'll help your child heal during and post-treatment. They have information for all different kinds of grants and financial resources and can guide you through processes that are extremely foreign to you. If you have a question about anything, if this person cannot help you directly, they will link you with the person who will. You also have patient care coordinators. They're kind of neutral facilitators that serve as liaisons between your child, your family, and hospital staff. If you have any issue with the care of your child, reach out to this person. You also, of course, have, different spiritual care services that are there to offer spiritual or emotional and grief support during any hospital stay or procedure. A lot of times that'll include your certified music practitioners, which are basically those trained in music therapy. I will tell you, Ella absolutely loves this person. Music therapy has been a tremendous help to her in her healing. You also have occupational, physical, and speech therapists, as well as technicians in each of the different hospital departments. This list by far is not exhaustive of all of the staff that you're going to meet or have already met while in the hospital. And while relationships matter, I think it's equally as important to treat everyone you interact with in the hospital setting with respect and value. You know, from the wonderful heroes that come into our room every day and clean our floors and disinfect and wipe everything down, to the cafeteria workers. You know, it's my experience that when you show people respect, they tend to take you more seriously. And if you really have any issue with a nurse or a staff member, those issues are addressed. So with that said, you know, not every hospital, nurse, or doctor is created equally. And if you have an issue with the staff member, you have to bring it up, because it's going to just affect the next person and the next person, and the issues are never going to get resolved. So, you know, you always hear the squeaky wheel gets the oil, and it's true. Closed mouths don't get fed, so speak up. In conclusion, there's a network in place to help you and your child through this process. Please take advantage of it. All of these people are important to you and your child's emotional, physical, and mental health. Use them, just don't abuse them. Thanks for tuning in to Mom Stinks. Please subscribe for your latest episodes. Ella Strong, see you next time. I love you, I love you, I love you, I love you.